Our guest today is Dr. Shamsheer Vailil, founder and managing director of VPS Healthcare, a rapidly growing company in the UAE. Dr. Shamsheer, thank you very much for joining us today on Knowledge at Wharton.
Thank you, Mukul. Thank you for having me here.
My co-host today is Dr. Mike Yusim, director of the Leadership Center. Mike, would you like to get started?
I will jump in, and Shamsheer, welcome to the program here.
Thank you, Mike.
And a couple years back, you were a practicing radiologist. You practice medicine, and now you deliver medicine, and you deliver it to a lot of people. The last time I checked, some 2 million patients a year come into one of your facilities. So just thinking about the transition from a person who practiced medicine to a person now who delivers medicine to a lot of others, what did it take to make that transition?
I'm trained as a radiologist. I spent almost 10 years of my life in medical training, then another 2 years for the master's, and then I realized that as a radiologist, my life would be more or less contained in the basements of the buildings of hospitals, because all the radiology departments are in the basements and you don't see the sunlight. And I decided that my life should be used for the larger good of public. And being in a business family, you always have that blood of doing something by yourself. And I worked for a year in the government hospital in Abu Dhabi. Then I resigned from the job and didn't know what to do. So at that time, didn't have any formal training in business, but I knew I had a strong desire to do something, to build a healthcare system which could clearly bring out the change for the patient. So with that dream, I started, and here I am with some good number of hospitals, good doctors, good team all around. So it's been a tremendous journey.
Shamsheer, I think many people have the dream of one day becoming an entrepreneur themselves. And from your experience, you opened your first hospital, I think it was in 2007. What did it take to finally make that decision? And then once you made it, what are some of the steps you took to begin to learn all the business skills you have to run an enterprise like a hospital?
It's always a learning day. Every day you learn something new, and as somebody who didn't know how to run a business or had no previous experience of running hospitals, it was a completely new challenge, and I was enjoying that journey. To be there every day, talk to the mechanics, talk to the contracting people, talk to them about construction, learn how the electromechanics work inside an operating room, how the wastewater should be ejected out of the hospitals. So everything was different, everything was learning, and I was very keen to learn. So I would be there early in the morning, spend 18, 20 hours without any problems, fully charged, don't get sleep because of the excitement, and which is still the case on some times when you have some interesting projects. So ability to learn was something which helped me a lot. I was a good listener. I would listen to people, and I would accept that I didn't have any experience. So I hired the best people on the job.
Yeah. It's a very interesting point, and that is to become a leader of a hospital, your chief executive of the system, which includes medical centers, pharmaceutical deliveries, not just hospitals in 3 different continents. You've had to become a general manager. You've had to do everything. You have to know everything.
I say I'm the owner and the cleaner.
That's very good.
My main focus is I don't involve in operations. My important task every day is I have a team of 15 to 20 people who are all across in different areas that we operate, who gives feedback after talking to the patients. And I get all the most of the impulse from the response from the patients. So I take it very seriously, and then I work backwards to the systems. If it's more waiting time, I need to talk to the CEO to see what can be done to reduce the times of waiting inside the emergency or in the pharmacy, or if it is an out-of-stock pharmacy situation, what to do to tackle it. So pretty interesting.
So you've built a very fast-growing business. I believe you started in 2007, and you are now, as I understand it, close to $1 billion worth of revenues. What was your strategy in building a business so rapidly in the UAE? What were some of the steps you took?
For me, it was all about building the capacity. I wanted to go where there were no facilities available. So for me, I didn't want to build a hospital and expect everyone to come to this particular building. I would rather look at areas which were devoid of healthcare and go build capacity, improve the capacity. Efficiency comes, then gives you that ability to negotiate with your vendors. It brings down your operating expenses. You have service line optimizations where you want to retain the best talent, you need to have certain volume. So that comes with capacity. So for me, I was more on, I was not focused on the revenues at all. I knew if I focus on the quality and get good doctors, that would bring me the revenue. So we went in for the accreditations. We got the US accreditations to start with. And that time it was not really required by any legal standards. But we went and got all these things, and it started teaching us how to do things in a more systematic way. Even though we have a lot of anarchy which comes with the growth that we have, but we have teams who are only focused on certain activities and they're not concerned about what's going around the group. So we have some people who are on the ground firefighting things every day, but some people who are on the top who goes around building new centers. Like me, I'm more into building capacity. I'm more into projects. You would see me at any point of time in one of those projects, the sleeves rolled up. I still love to do it, and I think speed is of essence. We take decisions very fast.
You know, we appreciate your courage in getting everything going back in '07, and we also appreciate your courage in moving out of Abu Dhabi. You're still there, of course, but in addition, you have operations now in Oman, not too far away. London, that's pretty far away. India, culturally quite a gap there. And you're here now in the U.S. to think about partnering with a couple of U.S. hospitals as well. Looking back on your movement out of your home territory, what's one of the more difficult cultural chasms you had to cross to make things work?
See, it's always the comfort zone that you leave when you go into a new territory or a new market. But you adapt very fast. You know the local cultural sensitivities. You know what ticks. You need to know the demand of the people. And I think if you can be Omani when you reach Oman, or being in London, you have to behave the way that what they want to see and what they want to hear from you. So once we can adapt to the local requirements of the market, regardless of the market, and keeping the patient need in the center, it works. And it's so good to of a time to exploit and to grow fast, because technology has grown. You could reach any part of the world. Tomorrow morning I'm having some meetings in London. I fly back to Abu Dhabi the same night. The next day I have something else. So you can't be in a better position than what you can dream about. So just use the time and take decisions.
So if you were to look back on your journey, and I assume that in the past 7 or 8 years it's just barely begun, what have been some of the most testing challenges that you have faced? How did you overcome those challenges, and what did you learn from them?
We started at a time when the insurance law was introduced in 2007 in UAE. And the same time, there was the financial world crisis which was going on. So there was kind of a lot of mixed responses to our beginning of the hospital during that time. But I was very confident that whatever the crisis is going around, healthcare is going to be the last one which is going to be affected. In fact, we saw an increase in the number of patients visiting the hospitals during those periods, because that leads to headaches, that leads to psychiatric consultations. Jokes apart, it's again the testing times which gives us that opportunity to be what the market needs. But you need to be realistic. You need to set the goals which are achievable, and then go all out.
You know, going back a little bit in our conversation here, one of the great aggravations that many patients complain about is wait time. And
yes.
You referenced waiting time and trying to get that down. In your own experience, what are a couple of the tactics, the management tactics, to cut wait time and, just to go back to another phrase, make the hospital that much more patient-centered?
I think the concept was to make a network of clinics all across, going to the communities, because we don't want patients to come inside the hospitals when they really don't have to come in, because it's unnecessary cost. It's a lot of headache when people should not be in the hospitals. Coming inside is, again, something that we don't want to have in our group. So we have started up opening clinics all across the communities, where we educate the patients that if it's something that they need on an urgent basis, that's the place to be. But if they are terribly sick, then then come to the hospital. So there's a difficult situation where you educate the public, and everyone wants to see the doctor when they're sick, and they want to be the first to see the doctor. So again, it's improving the accessibility point of view.
You know, it's really interesting because hospitals are there to bring patients in and render services. But from what you've said, one of your tactics here, one of your strategies really, is to keep patients out of the hospital. Yes. Clinics, wellness programs, better diet, exercise, and all of the above. And I think in that sense, you're delivering health services fully. It's not just what happens when somebody comes in and needs an x-ray. The best thing is they don't come in for an x-ray at all.
That's right. And what we have done is we wanted the hospital to do cardiac surgeries, neurosurgery, knee replacements, and let the patients who needs the wellness programs to go inside the malls, do their shopping, get into these clinics, get themselves checked on a continuous basis, because we have launched programs for the disease management of people suffering with diabetes so that they don't miss their medicines that leads into complications and end up spending a lot of money and time on recovering. So these kind of initiatives have been liked by people. Initially, they are kind of hesitant to go to outreach programs, but once they find value, that is when we can see there's a successful program launched.
So what are some of the most surprising, innovative things that you have tried out? I heard something about a dental clinic that was done quite innovatively. Could you tell us that story?
So there was a zoo on the outskirts of Abu Dhabi where a lot of children used to go, and I took my children as well. And I had one of my clinic managers who was just passing by, and we had a good discussion, and he came up with an interesting idea of why don't we start a dental clinic inside the zoo for the children who comes in, so that they walk in, they get a routine checkup done, we identify the caries, and let them know that there's a carie happening. And now, at that time, I thought it's a crazy idea, and I had to give him his due credit that I finally yielded into his compulsion of opening up the clinic. And now we got requests from parents to have some facilities, even for the parents to be inside the clinic when they come with the children. So I think these innovative ideas of reaching out to the masses, especially inside the malls, inside the hypermarkets that you see here as well. Healthcare is going to take a lot of change in the years to come.
You know, if you think about the years to come, digital delivery of appraisals, of diagnostics, I think it's out there, still slow to develop. But if we were to sit down in 5 years, my guess is digital medicine is going to be a big piece of what you're doing.
Digital is already there. We have diagnostic imaging, which is connected right across the group and can be reported from any facility or even from home. So that again reduces the need for a lot of radiologists on the ground, and that has really helped in faster decision-making process. So it's all about taking the right decision at the right time using the right technology, and that saves life. We have something called as the golden hour, where you need to be connected. You can't expect when that golden hour is going to happen. It could be on a Sunday, it could be on a holiday, and you don't have people on the facility. And then if you have a digital platform where people can log in, see the films, report the clinical needs, that could save a lot of hassle for the patients.
So just last week, India's Prime Minister Narendra Modi was in the US, and he was in Silicon Valley talking to a lot of CEOs there about something called Digital India. Mm-hmm. And I think as far as I understand it, the plan is to connect more than 600,000 Indian villages through a fiber network. What kind of opportunities would this provide, do you think, for healthcare providers, especially to people at the bottom of the pyramid who traditionally don't have access to healthcare?
I think this could lead to a lot of two-way communications when it comes to healthcare delivery. And to reach out to these areas are very difficult. They have their own logistic problems to reach out, to take the best of doctors to those rural areas. It's like next to impossible. So if you have the connectivity, then you have things like telemedicine, which could be used. We could have a lot of information passed down to these public in their own languages. So I think you could have a lot of two-way communications. You don't have to wait essentially for a complication to happen before they could talk to help. They could talk to somebody who can give them the help to overcome the situation.
For a person like yourself, going back to, let's say, '06 and '07, you were a professional radiologist, but inside you there was the entrepreneur and the business person. And for our listeners and our readers who got that entrepreneurial bug somewhere that one day may be more out and more recognized, what advice would you have from your own experience on that kind of a transition?
I think it's all about that, the listening to your heart, your gut feeling, and what you like to do. And I think that's what's very important. I remember when I was doing my training, I always used to think of a day when, I could have a hospital, treat a lot of people. That was always inside the heart, and there was a time when it came and I have to break the mold and come out of it and follow my heart, and there's no regret, because for me at that point of time the decision was there was no point of return, and I can't go back and do practice. So I think I would advise a lot of youngsters to come forward, to be in healthcare, especially because the world needs a lot more healthcare than what it is right now, and there are a lot of good things that you can do to make money, to do good for the people. There's a lot of corporate social responsibilities that you can do, and the world needs a lot of people from here.
Give it a try.
Yes, why not?
So one of the key attributes of any good entrepreneur, and I think you referred to it somewhat in your previous answer, is the ability to pick the right team. I was listening to Mark Zuckerberg from Facebook talking about how he selects people who are his direct reports. And he said, what I look for is if I am willing to work for that person, then I hire that person to work for me. What do you look for in your team?
For me, it's about people with the right attitude, the people who don't feel that they've done it all, they have seen it all, who would still have the fire in their belly, something to prove, and treat people with a lot of respect. And for us, we always had an issue with job descriptions. When I remember the first CEOs that I hired and they asked me for a job description, and I said that you tell me what you can do for us. So that was an approach that I've taken, and I still follow that. And I used to call a lot of the top directors when they join, I used to call them personally on a disguised name so that I get a good first-hand experience of how they are with people at a lower level. So kind of freestyling when it comes to recruiting senior people. They need to be people-oriented, people-driven, yet taking decisions and not afraid of the eventualities.
And looking back over the 8 years since you founded the hospital itself, could you pick out an incident or a decision or a time that seemed exceptionally challenging? And just walk us through what happened and what decision you reached.
Because we keep taking these tough decisions on a on a daily basis. But some of the decisions were we have to build a tertiary care hospital, and we were given a real estate building, and we were only given 10-15 days to decide whether we need the building or not. And it was a commercial building at that time. So we brought some consultants from US. They came and said it's not going to be possible. And that was a very difficult moment. And then I remember one of the local architects on the site, he gave me a solution for cutting across the vertical transportation, and that was a challenge. And I have to completely trust on him to take that building, which was something like a 200 million project. And looking back, that's something of a feather in our cap, and it has done extremely well. The hospital, which looked like a hotel, feel like a different environment altogether. We have gourmet kitchens inside. We have the music playing all the time. People come in to have a cup of coffee. So that's the building.
Just a quick observation on what you've said with a question to it. A lot of learning what you do now, you've learned by doing it. You went out, you made a decision. Should we open up a clinic at a zoo? I don't know, but let's try it and see what happens.
You call it paid experience, Some of it works. Some of it works, some failed. We had closures, but we learn from every mistake. We try hard not to repeat the mistakes, but eventually, keep doing the same mistakes. But again, it's the 80-20 rule. The 20% of those things which clicks very well compensates everything.
Yep.
So we have, I think, about a minute or so left, and I wonder if I can ask you to do a little bit of crystal ball gazing. Where do you see you and the enterprise going versus the next 7 or 8 years? You've already come a long way during the past 7 or 8 years. What's next?
We want to go global. We want to be in a lot of more markets than what we are right now. We want to provide a lot more advanced care for the less privileged across the world. We have manufacturing activities. We are getting very strong into the manufacturing activities as well. So what we feel is that we have to build a healthcare ecosystem where we have an integrated healthcare delivery approach where we control the various aspects of healthcare delivery, right from patient care, the logistics, supply chain, the pharmaceuticals, the back end, the IT, the home care. So we feel that that's where we need to go. It's a long journey.
Well, Shamsher, thank you so much for joining us today. Mike?
Yeah, thank you. This has been
Thank you.
terrific. We
Thank you,
appreciate
Mike.
your coming from Abu Dhabi.
Wonderful.
Thank you for joining us.
It was a
here.
great experience. Thank you so much.
Thank you so much for being on the Knowledge at Wharton show.
Thank you.
Thank you.
Thank you.